Hello everyone, today we are going to talk about facial liposuction. It is not uncommon for excess fat deposit to accumulate in the area of cheeks, neck, and chin. For some patients, these deposits are remnants of significant weight loss. For others, they simply develop with age. In any case, when such deposits prove unresponsive to diet and traditional weight loss method, facial liposuction can be an excellent treatment option. Liposuction of the face is designed to remove localized fat deposits that have accumulated in compartments surrounding certain areas of the face, such as the cheeks, jaw, chin, and neck area. In these specific areas, there is maximal skin movement, and the collection of fat represents wear and tear on the tissues. In this video, we'll explain everything related to this cosmetic procedure, how it is done, the expected result after the operation, and the instruction must be followed after the operation. Our role today is to answer most of your questions regarding facial liposuction. Today we have Dr. Kim, who is a leading doctor at Lara Plastic Surgery. He is going to discuss with us everything about LV facial contouring or facial liposuction from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases. Hello, Dr. Kim, how are you?
안녕하세요.
Can you introduce yourself to our audience?
I am Kim Un-hoi, Director of Plastic Surgery at Lara Plastic Surgery.
So we are going to talk about facial liposuction. So in which area of facial liposuction can be performed?
Any area with facial fat is possible, especially liposuction on the side cheeks, jawline, and double chin area. And as special parts, there are people who do liposuction on the cheeks here and sagging area here, and the side and the front cheekbones as well. Since this cheek area or the side cheekbones are areas that a lot of nerves pass through, we recommend that you perform surgery after consulting with an experienced doctor. If the operation is performed by an unskilled doctor, nerve damage may occur and movement may be difficult or sensory loss may occur.
So I've heard that facial liposuction is named differently in your clinics. It's called LV facial contouring. So what is actually LV facial contouring, and can you explain about it?
Yeah.
LV sculpting contouring is a method of inhalation using a microcannula in a handmade technique according to the individual skeleton of the patient, rather than by mechanical suction. Because skin sagging can occur when fat is absorbed, it is a signature surgical method unique to our hospital that uses PDO thread with strong tensile and fixing power to create facial contours. LV sculpting contouring is recommended for those who have a big face or big cheeks, and those who have small skeleton but a big face. Because it is handmade, there is less bleeding and bruising, and you can return to your daily life quickly.
So will the patient's skin become saggy after this procedure? What would you do about it?
The most problematic side effects after liposuction is sagging. In the case of sagging, thread lifting is recommended because it can be prevented in advance by using thread lifting, and the V-line can also be completed. Thread lifting is recommended for those who are old and have a lot of fat and have poor skin elasticity. However, sagging can occur even in young people. In this case, if you wear a face band called Dengem well and do stretching along with it, you can prevent facial sagging in advance.
So if thread lifting is needed, which type of thread do you usually use, and how many threads do you use?
In general, a soluble thread is used, but in the case of non-melting thread, problems such as inflammation may occur later, so a soluble thread is used. In the case of soluble threads, about 8 to 12 threads are used, and about 4 threads are used per side. In addition, since the tensile force or fixed force itself is different, depending on the type of thread, in the case of a thread with 360-degree protrusions, the cost is slightly higher, but it has the advantage of long-lasting power. In the case of PLA thread, it is recommended for those who are a little older or those who need to be fixed a lot. Since these soluble threads promote collagen synthesis, as the threads melt, collagen is formed there. And collagen replaces the lifting role in place of the threads. So even if the threads melt, the lifted skin is maintained for a long time.
So, can patient feel the threads after the procedure? Is it painful?
In the case of thread lifting, since it is performed in parallel with liposuction, the fat under the skin falls out and causes pain less frequently. And since the thread itself pulls the muscle layer, it is not directly under the skin, so even if the skin moves, there is no pain caused from the thread. However, if the thread is inserted too shallowly, it can be seen through the outside and may pop out when moving. So it is recommended to perform surgery after consulting with an experienced doctor.
So is it possible to have fat grafting done if the patient has already done a facial liposuction before?
Just because you have had facial liposuction, it doesn't mean that the fat grafting is impossible. Instead, it seems that there is no need for fat grafting in the area where the liposuction was performed. And in the case of fat grafting, it is recommended you don't go beyond the eye line, always inside the eye line. When fat grafting is done beyond the eye line, you can see the fat sags downward over time. Many people do fat grafting because the side part is dug, and most of these fats come down to the cheek side. Therefore, I recommend liposuction on the inside of the eye line and liposuction on the outside of the eye line. The areas for the fat grafting in the inner part of the eye line are the forehead, the front cheekbones, the nasolabial folds, and the marionette line.
So as I understand, facial liposuction can make our face look slimmer. So is there any procedure to change the shape of our face?
Naturally, various surgical methods are recommended depending on the cause. If you have a lot of fat on your face, we recommend facial liposuction. And if you have large bones, we recommend square jaw surgery or cheekbone surgery. In addition, if you do not have a lot of fat and only a small amount of a portion, we recommend a fat dissolving injection. The way to self-diagnose what kind of surgery you need is to lie down and look at your face. Then you will see what you might need. Because when you lie down, the heavy fat sags backwards, revealing your V-line. When you look at the face when you sit down, it sags downward. So if you have a lot of fat, the amount that sags downward will increase. Therefore, these people can get good results from liposuction. Liposuction is the most effective way to absorb a small amount of fat. It is a procedure that ruptures or dissolves fat cells by adding an external solution and reduces the volume there by promoting lymph circulation. Because it is more convenient and can be performed daily, it is recommended for those who do not have time and have a small amount of fat.
So are there any side effects of having facial liposuction?
Side effects of facial liposuction include sagging, dents, biobond, and scars that occur when you don't do enough stretching. In the case of facial sagging, thread lifting can be prevented in advance. And in the case of dents, we recommend that you consult with an experienced specialist for surgery. In the case of biobond and scars, the most important thing is that the patients wear bands and do enough stretching. If it still occurs, if you come to the hospital, we can relieve the scar with scar injection and high-frequency management, and you can quickly return to your daily life.
So when can people get back to normal life after this procedure?
Because facial liposuction is not as invasive as you might think, you can start your daily life from the very next day. In particular, when liposuction is performed on the face, all the solutions in it are absorbed the next day, and the most ideal face shape comes out. You can even film YouTube videos the next day, so please consider it. If there is no swelling or bruising, you can seep into your daily life from the next day. Cold packs are required for 3 days after surgery. At this time, swelling increases, so you must apply cold packs to reduce the swelling. Surprisingly, heat packs are sometimes recommended, but most people suffer from burns due to lack of sensation. Therefore, you do not need to use heat packs. After about 1 to 2 weeks, the swelling will reach its peak. After that, the swelling will go away. So if you work hard, you can see the face you saw the next day very soon.
You have mentioned about face band. Is it necessary to wear it after the procedure, and why is it?
When liposuction is performed, a space is created between the skin layer and the muscle layer. It's called a dead space, and it's easy to fill this space with oozes from our bodies. If you don't do it, the pus will accumulate and develop into scars. So you need to wear the band to prevent water from accumulating on the side to reduce scarring and prevent a swollen face.
And so for our last question, are there any scars after facial liposuction? And how long does the patient have to stay in Korea after the procedure?
In the case of facial liposuction that I do, the scar is very small because I use a micro cannula to remove it delicately using the smallest scar possible. In the case of these scars, no stitches are needed. So we do no stitching, which means there's no need to pull any stitches either. The patient only needs to change the regeneration tape until the wound heals. And if the wound heals well, apply the scar ointment well, and the scar will be invisible. In the case of scars, here, 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 and if the cheekbones are needed, here and here, so 2 more. In the case of foreign patient, you can leave immediately because you can have a very pretty face the next day.
네, 알겠습니다. 감사합니다. 네.
감사합니다.
Thank you.
Thank you so much. Today we learned many things about this cosmetic procedure, and the doctor explained in details everything related to facial liposuction. Thank you for joining us once again at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.